It's been more than 2 months since you were last with us, Dr. Fauci, and of course there's lots of questions that we have, including a lot of questions from our viewers as well. So let's get started. Dr. Fauci, you may have heard the head of Operation Warp Speed told my colleague Elizabeth Cohen today that he, quote, wouldn't be surprised if the vaccine was about 90% effective. Now, we've only seen phase 1 data for these vaccines, very early data. That seemed like a significant sort of estimate in terms of its efficacy. What evidence is there out there to give people like him that confidence to make a statement like that?
Yeah. I mean, that's obviously a very optimistic estimate. We all hope it's going to be that way. When we look at the data from the phase 1 study, relatively small number of people, though it might be, it looks good because the vaccine-induced neutralizing antibodies in the recipients rather robust to the level that you would say is at least as good or better than what's induced by natural infection, namely what we're seeing in convalescent plasma. So that's the first good indication that gets us to be optimistic that we'll get a good percentage. I'm not sure it'll be 90%, but I think it's going to be reasonably good. And also the animal data look really good. In fact, very recently, like yesterday, published New England primate data, it showed really good. Not only did it protect the animals, but the actual virus was not really seen in the nasopharynx and in the lung, which is really bodes really quite well. That's why we're cautiously optimistic. But, you know, as we've said all the time, you just never can tell. The proof of the pudding is to do the clinical trial and get the result. And that's actually what we're doing. You know, we started the phase 3 trial 4 days ago, this past Monday, and we're starting to enroll patients in a vigorous way, so we're looking forward to it.
He also said as well, Dr. Fauci, that he's pretty optimistic that we would have vaccines for everybody within the year 2021, ideally within the first half of the year. Again, you know, I want to make sure that we're managing expectations here. Do you agree? Is that a realistic goal?
Yeah, let me tell you where that comes from, Sanjay. The company that is making this, in this particular case, it happens to be Moderna with the mRNA platform technology, that we've already begun the contracting with the groups that make vaccine, and we're proceeding in what's called at risk. In other words, start to manufacture the doses of vaccine even before you know the vaccine is safe and effective, which is a financial risk, not a risk of safety, not a risk of scientific integrity. It's a financial risk. They promise us that they will have in 2021 at least a couple of 100 million doses of vaccine, and maybe even by the end of the year of 2021, up to 1 billion. This is what they're telling us. I hope that that's deliverable. If it is, we're going to have what was just promised.
A new study published today found that kids younger than age 5 have between 10 and 100 times more genetic material from the coronavirus in their noses compared to older children and adults. I know this study didn't measure transmissibility, but it does raise questions about how easily the virus may be spread by kids under 5. How much does that concern you, and just the fact that we keep learning more about the virus effects on children?
Well, it does concern me, definitely, because, as you know, we're still learning as the weeks go by and we get more and more information, a lot more about children. There was a Korean study that you remember that came out just a week or so ago that showed that children from 10 to 19 transmit virus to adults as well as adults transmit to adults. But that doesn't seem to be the case with younger children. Now you get this study, which is interesting, that says younger children up to 5 years old have many, many more times virus in their nasopharynx than adults do, which would mean it would be a reasonable assumption that they would be able to transmit the virus.
So they're not immune.
We just need to figure that out. And in that, no. I mean, they have virus in their nasopharynx, which means they very well could transmit it. We're doing a study that we started in May, and we'll get results in December, called a HEROES study of 6,000 people and 2,000 families, of looking at the incidence of infection in children, how well they transmit, do they transmit it to their parents, and vice versa, and what's the level of virus in their nasopharynx. So we're getting more and more information as time goes by. But you're right. The study that shows that young children have a lot of virus in their nasopharynx is of concern when you're thinking about transmissibility.
I wonder if we could take a step back for a second, Dr. Fauci. 6 months in now, where do you think we are in the arc of this crisis? We talk about vaccines in the past. You've said first or second inning. I know you like baseball metaphors, but where are we really, in the arc?
You know, it's impossible to predict, Sanjay, because, when we were looking at the increase and then going down, if it had gone all the way down to baseline, the way some of the European countries and the Asian countries have done, then you could say, if we hold tight, we may be in the 7th or 8th inning, if you want to stick with the baseball analogy. But that didn't happen. We came down to about 20,000 cases per day, 20,000 for weeks and weeks and weeks. And then we had the unfortunate surge in the southern states where it went up to 40, 50, 60, 70,000 per day. And now it's down between 50 and 60,000. So when you're at that level, the thing we need to do is we need to put out all the stops to get it down to baseline and to keep it there by doing the things that we've been talking about and that I've been talking about consistently. If we do that, Sanjay, I think we're well towards seeing this under control. If we don't, then we really can't make a prediction about how long this is going to last.
I saw you say something about face shields, eye coverings, and I just want to clarify because I just saw a headline of it online, and it kind of concerned me. So, should people be wearing something that protects their eyes as well as a mask?
Right. Sanjay, it's interesting. You sneeze and it's a headline. I was talking to a group of teachers in a chat, in a fireside chat, and one of the teachers made the comment that they asked, can the virus enter through the eye? Because some of their teachers were seeing people on television and wanted to wear eye shields. And my response was, well, certainly, if you have an eye shield and you'd like to wear it, it could help because virus could enter through the eye. That's not a recommendation that everybody should be wearing an eye shield.
Okay, because I was about to start searching, looking for eye shields. I want to get some questions from viewers. Dave in Kansas City sent in this video. Let's take a look.
We have 2 children, ages 10 and 14, and we need to decide what to do with their schooling this year. The 2 options are in person, 5 days a week with masks and social distancing, or virtual online learning 5 days a week. We think they would do fine with virtual learning, but probably a little less strong on the education front, and would also be losing the socialization, but at the same time, it would be less risky. Just wondering what you would choose in this situation.
It's a tough one, Dr. Fauci, I mean, for so many parents.
No, it is, but let me just take a very brief general principle that in general, we should try as best as we possibly can to get the children back to school because we know of the deleterious consequences on the children when they're kept out of school, as well as the downstream deleterious unintended consequences on families of parents who have to get off work to take care of their kids. Having said that, there's a however there. And the however is that we live in a big country, and the level of virus in one part of the country versus another can be very different. So if you have a level of virus that really is very, very low, then you could likely proceed with impunity, depending on the local situation, with getting the child back to school with no restrictions. If you're in an area where there is some virus involved, the local authorities may do things like try to modify the school situation, namely alternate days, morning, afternoon, some outdoor classes, wearing masks. And then when you're in a situation where there's a lot of virus, where you really have an explosion of virus, then you might want to think twice. The bottom line, Sanjay, is you've got to be flexible. You've got to be flexible according to the situation on the ground, and it's a local decision. So I would ask this caller, take a look at what the situation is in the location where you're at and abide by what the local authorities are saying. And the CDC has guidelines that you could take a look at that I recommend.